Thank you, Mr. Speaker. Mr. Speaker, I want to firstly join you in welcoming colleagues that have joined us in this house. You're welcome. These colleagues gave us commitment in the Appointments Committee, and they have reinforced that commitment when they took oath that they are going to serve diligently, observe the law, and as we promised then, we promise now, we are going to hold you accountable to that and to the oath that you have taken. Mr. Speaker, you've made a very critical remark and asked them to be present in the House. In the past, we have had challenges where we look for particular ministers and they are absent. We have questions from both sides of the House, and ministers are not present. And so the government chief whip, see her running around making calls, trying to get hold of them. So please make your whips work easy and be available to respond to this question. Sometimes, by the way, an unsatisfactory response is better than no response at all. Yes, that we ask a question, you give a response, we are dissatisfied, and then we can quarrel about the response. But at least there's a response. But it's more problematic when there is no response at all. So we remain in abeyance, but we hope that you will live to the oath that you have taken. Mr. Speaker, I have severally raised something, and the House has asked government to follow up. I'm glad the Minister of Health is here. Again, I want to appreciate the government chief whip. The issues we raise, she follows up. She writes, I get a copy that this matter was raised, so she writes to the relevant minister asking them to follow up. That's a good thing that should keep happening. So that then we are able to keep track. So one of those issues was about medical interns, Mr. Speaker, that I've raised severally here. Today I received a letter written by the President of Uganda Medical Association. He has written to the Minister of Health, medical doctors, healthcare professionals, key stakeholders, and the general public. So I received this letter in two capacities. As a key stakeholder, because Parliament is a key stakeholder, and as a member of the general public, because indeed I am a member of the general public. Uganda Medical Association is giving a position on the welfare of medical interns. We have asked this question again and again. Government has yet to give us a satisfactory response. So the medical professionals are, one, encouraging the interns not to show up where they have been posted. It's in this letter. And number two, they are saying if in 14 days government has not addressed the issue of facilitation of medical interns, the doctors, all the doctors, are going to carry out industrial action and lay down their tools. And they're saying throughout the industrial action, only emergency care and essential life-saving services shall remain available. I firstly want to table this letter. I don't know if the Minister of Health has gotten his copy, but me, I've gotten mine as a member of the general public, so I'm laying. The concern, Mr. Speaker, is when this issue is not being addressed by government consistently, we get a problem. Because medical interns were posted. Many have not reported to their postings. Why they're saying they don't even have transport to get them there. They need resources to rent where they'll be staying, for feeding, for transportation, because many will not be staying very close to their health facilities. And these people are saying they are not students. They are medical doctors who are now on practice for the 1 year that is mandatory. That's their argument. As I mentioned the other day, the Minister of Health was not around. He has been moving around different health facilities, sometimes in the middle of the night, 2 a.m., 3 a.m., to monitor. And who does he find at these health facilities? It is medical interns who are doing the bulk of the work. And so they're saying, government, why do you not want to value the work that they are doing? But number two, how do we expect them to go and do the heavy lifting? Sometimes they are on their postings for 48 hours non-stop. We need a response to this matter. Now I'm worried when there is a threat of industrial action by all medical workers. And I know, Mr. Speaker, it's easy to say, you medical doctors, be patriotic and report to work. But they are saying, government, be patriotic and pay them for this service. We need a response to this matter, Mr. Speaker.
Thank you. This issue, yesterday I received several members raising it on both sides, even today. So when the minister was entering, that's the issue I told him. At the end of matters of national importance, I'll give him a chance, he updates us. But since you've raised it now, Lop, I think the minister can respond right away.
Thank you very much, Right Honorable Speaker, and the Honorable Leader of Opposition, the Honorable Members, for raising this concern. Yes, this matter was raised, and the last time I gave a response was, I am undertaking consultations. I have a draft statement for Parliament, but I have not concluded all the consultations I needed to do. But just in terms of update where we are, this matter is arising from a new policy that has been passed regarding health training, and which affects interns, deployment, welfare, and other aspects. I did meet the interns, the pre-interns, because they are not yet interns. You become an intern when you qualify and report and sign a contract with the management of the hospital where you are doing internship. That's when you become an intern and you have a relationship with the government. At the moment, those who are writing are graduates who have completed their university training. They have passed and their names have been forwarded to the Ministry of Health for deployment. We have indeed deployed them to all the hospitals where internship is done. And the deployment letter was saying you report between the 3rd and the 14th of this month. I did meet the leaders of the pre-interns, about 60 of them, and we had a lengthy and cordial discussion of about 6 hours. It is rare for a minister to accord 6 hours to a group, because we have a lot of work that we do. But I patiently had a discussion with them for 6 hours, and we did agreed that one, yes, we share the concerns regarding the new policy measures regarding their welfare, and I undertook to do consultations, but urged them to report for deployment as the consultations get concluded. I think the challenge that these young people are getting are external forces that advise them, you lay down your tools, you don't report. I must state that the interns need that internship if they are going to practice the professions in which they have trained. Interns, I don't want to sound like insensitive, are not employees of government per se, but internship is a period when you are transiting from being a student to becoming a fully licensed professional. That should be clear. It is also not true that is interns who run health care in this country. Yes, they make a contribution, they provide labor as they learn, but the health care is provided by different cadres in the health sector. For instance, we have health center 3s, health center 4s, and a number of district hospitals where we don't post interns. Are we saying they are closed? Are not running. For instance, the team which has been doing internship has now concluded their tour of duty, and now the new ones are reporting. We have not closed any hospital because there are no interns. So it is not true to say that it is the interns who run healthcare in this country. But we do definitely appreciate the work that they do as they train to get fully licensed. So I am sure the interns are watching me. They should get that fact, that they need this internship. We have the commitment to address the concerns which they are raising. And that's why I'm asking for additional time to conclude my consultations so that I can come with the final position we are taking.
Honorable,
No. So,
do you anticipate when you might conclude the consultation?
maybe by next week I should be ready. By next week, I should be ready.
Procedure?
But that's the position. So the deployment,
Procedure.
Honorable Kwizera,
Eh,
you've been here long enough
so-
to know you cannot access a microphone.
so right
without
Honorable
the permission of
Speaker,
the presiding officer.
Right Honorable Speaker, I did guide the pre-interns that a matter where there is goodwill to listen to them, we have not condemned them, and we
The auditing matters we are handling, we are about to handle, we are going to handle regional referral hospitals. Right Honorable Speaker, one of the major auditing query that comes out are the staffing levels in these regional referral hospitals. To dismaying structural levels, that a hospital that has a structure of 100, they have about 23%. They have 24%. They have 27%. Actually, the one I saw which was doing best had 27%. Right Honorable Speaker, when the people of Uganda say that it is the interns that run these hospitals, they are in a reference to the inability of government to have enough wage bill for these regional referral hospitals to recruit and have staffing for doctors and health workers in these institutions of ours. So the procedural matter I want to raise is with the minister, who is up to now claiming that it is not these interns that run these facilities. Right Honorable Speaker, yesterday I went to Naguru.
Procedure matter, Honorable.
The procedural matter, Right Honorable Speaker, is whether the minister is here proceeding well to emphasize the fact that these interns need the training other than the service our people receive from these interns. Thank you.
Minister, are you proceeding well?
Right Honorable Speaker, I will soon be, I think the Right Honorable Prime Minister last week, when commenting on the proceeding business, she undertook that we shall bring a comprehensive paper on the delivery of medical services in this country. And I hope we shall have enough time to discuss all those issues.
That is this week. She promised this week. So I've been waiting for it.
I have been waiting for the order paper to come out.
No, but I don't have a statement. I only put on order paper, statement submitted to the clerk. Yeah, the statements, Honourable Minister, you know, you submit to the clerk, then the clerk presents to me, we look through as a team, and we say, let us put this. I don't want to put you, and then you come to apologize.
Me,
Say-
I'm ready. I can address you on that subject.
So
Anyway,
can I
shall
put you tomorrow, Honourable Minister?
Yes, no
So
problem.
kindly share the statement today. Share the statement even in the morning, then we put you on the
Okay,
order paper.
no problem. There are two statements. There's one for interns, then one for the comprehensive services.
Comprehensive
So the one for the interns, I'm concluding the consultations. The one for the comprehensive delivery of medical services, I think our offices will arrange, and tomorrow I will be set. But let me, as I conclude,
Honourable Kwizera
Yes.
raised the issue. You can also touch it.
I did say that the debate on interns arises from a new policy on the health training, which encompasses issues of pre-service training, that is at university and tertiary education level, but also in-service training like the internship. So there is a policy that has been passed, which when I bring the statement, we could get copies or extracts of.
No,
Extracts from
Honourable,
the
just lay
policy.
on table.
Yes,
Okay?
so I will
you
bring-
your lay on table, then we shall distribute it electronically to members.
Okay, no problem. Then the issue, I want to state, we should speak with evidence. There is a time some years back when interns delayed to report for about 6-7 months. And when the Ministry of Health did analysis, found that mortality rates went down in institutions, in hospitals. Yes, just hold on, yes. Yes. You see, we don't speak for the sick. Mortality rates, but the senior health workers, doctors, were available, although they overworked. But the mortality rates reduced. The meaning of that.
Point of
Mr.
order,
Speaker.
Honorable Zake.
Mr. Speaker, is the minister in order to say that when the interns delayed to report to work within 6 months, that the mortality rate went down? You have said right here that we speak with evidence. Can you please table the evidence?
Now, you see, you asked, you made a ruling, you did.
Mr. Speaker, is he in order to say that the mortality rate reduced to that level? Give the evidence. Give the evidence.
Thank you.
Are you in order?
Honorable Minister, you know when they put you on order, you wait for a ruling. Yes. Yeah, now, colleagues, that becomes difficult for the Speaker to rule on. Because if the Minister has his facts, okay, based from statistics, so maybe we can ask him to expound on that, to give us more. But I hope our interns are not a danger, okay, are not a danger to our patients and community.
What I am raising on the floor is factual, because I cannot be reckless on the floor of Parliament. But the implication and the meaning of that was that our senior doctors usually are absent and cheat government. They don't even do adequate supervision of interns. So you find interns are doing the work unsupervised most of the time. And there are discussions we are having in the ministry to bring reforms, like we are going to discuss the issue of dual employment. I have said this in public, that you find a consultant doctor is employed in Murago Hospital, but probably he offers only 10% of his time to Murago. The rest of the time, he's in his private clinic. There are doctors who are consultants in the government hospital, but you find he's heading a department in a private university, and that's where he spends time. So that the fact I have given you speaks to that the interns, you find most times, do internship without proper supervision from the seniors. That's why I said the seniors were ordered to be on the wards and they were there in hospitals, and mortality reduced. I can bring you documented evidence on that when I come.
Thank you. Honourable Minister,
So,
conclude.
In conclusion, my message to the pre-interns is that we expect them to report. And on the 15th of this month, I will ask the directors of the hospitals to give me an update in terms of who has reported. No. Allow me to run the ministry. And those who will not have reported will be considered to have forfeited their placement for internship, as we handle their issues. So please, the pre-interns who are watching, report. No.
But Honourable Baryomunsi, I don't know why you're listening to neighbors. You're the only one on record.
So
But-
let the interns report as their issues get handled, because we respect them, we respect what they are raising, and we feel concerned about them. We are not resisting what they are saying, so there should be, and they should not be misled by anybody to start confrontation with the government. It will not pay for them. I thank you very much.
Thank you.
Speaker.
Now, Honourable Minister, on our side, we hope you can conclude the consultations. We hope you can conclude the consultations. And from my experience of the little time I spent in cabinet, I usually don't want to push ministers to make commitments in a certain way, because sometimes, especially if they have a financial implication, they need concurrency with cabinet. So I do hope that Monday, Honourable Minister, I do hope that Monday you can raise this matter in cabinet, you consult further, you conclude on it, and then on Tuesday you update the House. Yes, I hope that will be more helpful. Yeah. So, honourable colleagues, today is International Youth Day. Yes. So, congratulations to the youth of Uganda. Now, you see, government chief whip, government stopped celebrating these holidays, okay? But we request that we remain with the practice of bringing statements here, okay? Of bringing statements here. So, but the Minister of State for Youth is here, our youthful sister, Honorable Akisa. She can make 2 minutes. But Honorable, it would be good if you bring a full statement so that it is debated and we see how the youth of the country are doing in terms of government services. Just 2 minutes.
Thank you, Right Honorable Speaker and Right Honorable colleagues. As clearly stated, today is the International Youth Day. It's celebrated annually on the 12th of August, and it was established in 1999 by the United Nations. As a country, our theme is empowering young people for inclusive wealth creation and sustainable development. However, the global theme is different contexts, common aspirations. It recognizes the fact that as young people, whether you come from the north, the west, or the east, we have our own different challenges, but our aspirations are definitely the same. And today, in the morning, we had a virtual celebration. There was an address by His Excellency the President of the Republic of Uganda through the Vice President. I hope that in the evening or in the news or tomorrow in the papers, you will have the full address of His Excellency to this day. And I urge all of you to join hands as we try to, first of all, eradicate the poverty that is within our young people, and also government is committed to ensuring that we empower our young people and get them into the money economy. I thank you.
Thank you. Thank you, Honourable Minister. Honourable colleagues, also still in my communication, I also want to give 2 minutes, just 2 minutes each, to the new ministers, the newly sworn in, who have just come in, starting with the senior Honourable Adonia Yebare. Yeah, because it's still on my communication.
Right Honorable Speaker, Leader of Opposition, dear colleagues, let me begin by thanking you for welcoming me, and I promise that I will be, as much as possible, be present in this house to where required, answer some questions or give statements. I look forward to meeting most of you and to serve this country and to be an active member of this house. I thank you.
Thank you. One of the advices I give you, that always join members in the canteen, have lunch with the members. That's a platform where we easily connect. Number 2, we have East African Parliamentary Games, so we expect you to participate in the games. Jeno Keke has dodged us on the golf team for long, and yet he's a very good. Now he says he's part of the UP. Honorable Schatz.
Thank you, Right Honorable Speaker, honorable colleagues of the 12th Parliament. I'm grateful for this opportunity to to have caught the eye of the appointing authority. So I thank His Excellency, the President of the Republic of Uganda. I want to thank the people of Zimbabwe for having served them the 11th Parliament and taken keen interest in matters of financial inclusion. And therefore, the docket that I now serve in with my great minister seated behind me is one that I'm passionate about, and I look forward to visiting your areas and making sure that our people understand what this government has in order to make sure that no one is left behind and that our people take advantage of the money economy and the President's message. Thank you, Right Honorable Speaker.
Thank you. Honorable Witonze. I think Honorable Witonze had become a big part of us. Always with us in the canteen, always moving in the corridors. And he looks a very rich man. This size and Honorable Witonze. Rich people, the microphones are switched on for them. And
Honorable Zake, pole. Thank you, Right Honorable Speaker. Honorable colleagues, thank you for welcoming me. First and foremost, let me first thank you for overwhelmingly voting for me when I was standing as Yara Member of Parliament. Yes, I performed very well, but unfortunately, I didn't make it. But fortunately, the appointment authority saw it better that I fit to sit here. So I'm so honored, and my pledge is one. My ministry requires me to be here every time. Right Honorable Speaker was briefing me, and I promise I will be here with you to answer your questions. And to be with you. Yes. So, thank you so much. And please, I'm here to learn. Guide me, and your counsel is welcome. Thank you so much. God bless you.
Thank you. Thank you,
Honorable
Honorable.
Zake.
I can see a connection between Honorable Zake and Honorable Witonze. Thank you. Honorable Joan Namtawe. Matters of national importance. Honorable Joan Namtawe.
Thank you, Right Honorable Speaker, for the opportunity to raise a matter of national importance concerning a crisis at Chanamkaka LSS Center 4. Right Honorable Speaker, Chanamkaka LSS Center 4 in Chanamkaka Town Council is operating without a mortuary. The deceased are kept in the same wards with patients until they are picked by their relatives. Right Honorable Speaker, I kindly appeal to government to intervene immediately to solve this crisis. Thank you, Right Honorable Speaker.
Honorable Minister for Health.
Thank you very much, Right Honorable Speaker, and thank you, the Honorable Member, for raising the matter. Chanamkaka Health Center 4 is in the Masaka district. Yes, and the challenges she's raising, Rio, there is a project that, there is financing which we are negotiating with the World Bank, and Chanamkaka Health Center 4 is lined up to be among those to benefit from that funding. And once we conclude the discussions and acquire the resources, we shall be expanding that health center and upgrade it to a community hospital by having a functioning theater and other infrastructure. But in the meantime, I will send my team from the infrastructure department to come there physically and do an assessment and advise on what we can do to provide for mortuary services as we conclude the negotiations for financing, which will expand that health center. Right, Honorable Speaker.
Thank you. Now, honorable colleagues, I've always guided matters of national importance. These are part of my communication. Okay, it's the generosity of the returning officer. Otherwise, you are provided for under rules. Yes, you can always raise issues as provided for under rules. But during my communication, I can always allow, and I do only 5. I never go beyond 5. Now, this should, but a lot is going on in the house. Hello, Honorable Bigaros. I don't know what's... yeah, colleagues, you can move without talking. Yeah, you know. I want order in the house. So, 1, you must bring these issues to my office. Okay? Or to whoever is a presiding officer. You're always guided. Now, I know many of you come and I guide you because matters of national importance, these should be issues which have happened either today or yesterday, should be emergence, and then you can get a solution, a quick solution here. The rest can always be addressed. Number 2, I don't pick them out of the cheats you send me here. Or, you know, yes, out of the cheats you send me when I reach here, you bombard me with cheats. No, I need to concentrate when I'm here. I need to concentrate. And also I think I'm going to be controlling how many members can come on the table. Because I cannot be doing both tasks at once. A member is on the floor, I'm listening, and then someone is engaging me here. Unless I've called you, yes, unless I've called you, please don't come to the table of the presiding officer. Okay? If you have an issue, you can just send a chip, and then I'll be able. Otherwise, I don't concentrate. I have to listen to a member, and then at the same time, I'm engaging a member here. It becomes difficult. Okay? On a rope, and the government chief whip or prime minister has the right. The commissioners should be in the back bench, concentrating, monitoring. Yes, Honorable Sir Maureen.
Thank you, Right Honorable Speaker. Right Honorable Speaker, Arua is land known for business, and where people are not trading, there's a big problem. On the 28th last month, July, our county was declared Ebola-free. And now our border markets still remain closed. 2 days, Right Honorable Speaker, 2 days ago, we had a delegation and a team that went to the Machaku market. That is a team that included the WHO, the task forces for Arua City and Arua District, together with the security personnel and the mayor. But when they reached on ground to go and assess what's happening at the border, they were all received by the hostile community. And the mayor was stoned. That's the mayor for Aivu Division. Now, Right Honorable Speaker, our people are asking, ever since Uganda has been declared Ebola-free, yet Congo, just 5 meters away, the markets are operational, and they've never closed their markets. And our people, yet, they have been in one place. Because the security are there, they have been monitoring what's happening at the border. And now that, Right Honorable Speaker, my people are requesting that they want to know from the Ministry of Health, what is the position of the government on reopening not only the market in Arua City, but all the border markets. Because of Ebola, everything has been down, and people must survive daily.
Thank you.
I wish the ministry could hear this cry of Arua City and the other border markets. Thank you.
Honourable Minister.
Thank you very much, Right Honorable Speaker, and the Honorable Member of Parliament for Arua. On the 15th of May, the Ministry of Health announced an outbreak of Ebola disease. And on the 28th of July, I announced the end of that outbreak. And in my statement, I did say that while we are declaring the end of the outbreak in Uganda, where we registered 20 positive cases, there is a problem on the other side of Congo, because this was an imported outbreak, where out of the 20, 15 were Congolese nationals who had come into Uganda. And our president and the president of DRC were in touch. They commanded us as ministers of health to work together and put regional and cross-border interventions to manage this outbreak. Now, there is a huge difference now, because also DRC declared an outbreak on the 15th of May, the same day. While in Uganda, we have declared the end of the outbreak, in the DRC, the opposite is happening. That they have since registered 4,380 positive cases and over 2,000 deaths. And the infections are on the rise, And we have sent there our health workers. We have established treatment centers on the side of Congo, in Aru, which is opposite West Nile, and in Kasenyi, opposite in Toroko, Lake Albert. We are also going to open another one in Mahagi, which is opposite the Nebi Zombo area, and maybe Kasindi, opposite Kasese, because in Congo, the outbreak started in one province of Ituri, but has since spread to 5 provinces. So the situation is not good. And what we see is that the infection rates are quickly approaching the border of Uganda, including the West Nile. So in our statement, we said we are declaring Ebola free, that the outbreak is over, but the risk remains of a potential of cases crossing over from DRC. And therefore we guided that we keep interventions and public health measures, especially in the communities bordering DRC. So true, the markets and other gatherings are still restricted. I know it is hurting our people, but the guidance I would want to give is that next week we are going to meet as a task force chaired by Her Excellency the Vice President to review those measures. But we would want to appeal to the communities near the border that it is in good faith and for the sake of preventing potential cases of